I'm Cassandra, and I'm here with Nicholas, and we're here to talk about the Northeast St. Pete. Here's the historical overview. The Kenyon family was the first known family in the area. This is a Chicago family that sold their property to the Alice Bernard family for $200. Alice Bernard died in the year 1908. Snell bought the property from her estate for $2,000. He started an organized group called the Bayshore Land Company around the year 1905. His crew developed the land that is east of 1st Street and 5th Avenue North to 12th Avenue North around the year 1912. The men started to build up upon this area with homes, water, and sewage. This heightened the curiosity of a man named Hamlet. J.C. Hamlet, together with Snell, bought the remaining 400 acres. The structure. The old Northeast community appears to seek the crowd of the middle-class family. The homes are Spanish descent and very nice. There are homes that were built along the coastline of the Snell Island community. There are several million-dollar homes in this area. The community meets the needs of the population. There are many grocery stores and convenience stores in the area. There are also health-related facilities in the area. And there are many forms of transportation that is available for pedestrians in this area. The community lacks the convenience of a hospital. The closest hospital to this community is Bayfront Medical Center. There are a few urgent care and primary care physicians in the area. The community feels that there are not many laundromats available in the area. There are also side comments about breakfast spots being open before 7 a.m.
Poverty levels in the Northeast St. Petersburg community are higher than the average for the county and the state. Poverty is an ongoing issue for many developed countries. The industrialized world has seen unprecedented growth in the past 20 years. However, poverty rates have dropped only by about 2% in countries such as Canada. Many Canadian families are considered working poor, where one parent is working full-time. St. Petersburg population will have similar needs to these communities: increased advocacy for changes to policies, increased wages, and increased financial assistance is recommended. Unemployment in this community are higher in St. Petersburg than in Pinellas County or the state of Florida. The financial hardships associated with unemployment increase the risk of mental illness and self-harm. 1 to 2 week classes called job clubs have been shown to provide support. These job clubs involve classes on problem solving, decision making, social support, job and job search skills. These classes help to build self-esteem and inoculate the patient against the setbacks related to joblessness. Cancer and heart disease are 2 leading causes of death in the St. Petersburg community. This is consistent with the 2 leading causes of death in the United States as a whole. Nationwide, the heart disease-related deaths have decreased in the last 60 years. However, the incidence of cancer mortality has increased in the last 30 years. Due to the fact that this trend is seen across the country, we can see that this is not an isolated issue to St. Petersburg. The community nurse can take steps to aid the community with this issue. Cancer prevention education, which includes information on smoking cessation, is a helpful first step. Assistance to obtain smoking cessation aids such as patches and gum may be an intervention performed by the community nurse.
Adequacy of health-related resources and availability. Access to resources. There is an organization called HANA. This stands for the Historical Old Northeast Neighborhood Association. This organization is one of the oldest founded organizations in St. Petersburg today. It was founded in the year 1974. The old name of the organization is North Shore Neighborhood Organization. The name change happened in the year 2002. HANA offers more than 35 events annually to ensure the needs of residents in the community. The community also offers outreach programs through the local churches. Acceptable to resources. HANA services are acceptable for a community of North St. Pete. They assist with reemployment assistance and senior transportation services. Affordability of resources. Resources in the old Northeast community is affordable. There are programs that help low-income families as well as elderly assistance. Medicare and Medicaid is accepted in this area. Affordable housing-based homes are also available in this area. Objectives. These objectives were based from Healthy People 2020. So there's three. The community will reduce the rates of the emergency room visits due to falls in the next 5 years. The geriatric community must be educated on ways to decrease falls. These falls are causing fatal injuries to this community. The second one is the community will decrease the rate of alcohol impaired driving in the next 2 years. Driving under the influence is a very serious and ongoing issue. There are 5 liquor stores in the old Northeast area. There are over 22 million Americans struggling with alcohol and drug abuse. The third one is the community will reduce the use of cigarette smoke in the next 5 years. Tobacco use has been proven to cause health-related problems.
Wastewater treatment is adequate in St. Petersburg. It is cost efficient with members of the community funding the services. St. Petersburg has a variety of publicly accessible areas for solid waste disposal. Residents have curbside pickup several times weekly. Air quality is adequate. The quality is regularly above average acceptability. Vector control needs improvement in the city. There are many reservoirs for mosquitoes. Mosquitoes are regularly seen year-round in the community. Rodents such as fruit rats are seen in all parts of the community. Programs to aid in sealing homes to deter rodent entry may be helpful. From 1996 and 2006, the United States increased spending on policing by 8.6% each year. There are a number of theories as to why the spending has increased. Police are responding to many calls that are not necessarily criminal. Police departments are expanding. It has been suggested that police departments are buying new technology but using it inefficiently. Therefore, the departments are doing less with more. Citizens are bearing the cost of these expenditures. Half of St. Petersburg's public safety budget comes directly from its citizens. The 2019 fiscal year budget regarding the marina includes a decrease in the scheduled debt payments. The net revenue reduction is estimated to be $272,189. This is related to a decrease in fuel sales and a reduced rental of boat slips in the city. This will slow the reimbursement of St. Petersburg's debt. City council meetings have recently been held online. City council meetings are well attended by council members. There are several different methods for residents to participate virtually, either through Zoom or email. Although the meetings are accessible by the public, they are not well attended by the public. Young people are underrepresented in the city council meetings. The city council enacts laws and policies that are carried out by the city. Representation of all community members is essential in providing for the citizens of any area. Without proper representation, certain areas of concern may be neglected. A more diverse representation in city council meetings ensures concerns of all parts of the community will be addressed. Heart disease and cancer are two of the leading causes of death in this community. Risks of these diseases can be reduced with lifestyle changes. Smoking cessation is critical to reduce the risk of cancer. Reducing the rate of smoking will reduce cancer and heart disease risk for the community. Fresh fruits and vegetables should be provided at no cost to families who may not be able to afford them. Increased fruit and vegetable intake will assist the community in lowering the cancer and heart disease risk. Most of Northeast St. Petersburg is considered Zone A for evacuation. Zone A is the first to evacuate in case of emergency. The disaster preparedness site needs to be modified so that the site is accessible and functional for all residents of the community. There are several main routes through the county for evacuation. The main route is over Tampa Bay or along the coast. These areas become very congested easily. Multiple routes are needed to ensure a safe and timely evacuation.
Planned Parenthood is a community asset that should be addressed a little more. Unintended pregnancies happen to all women, and a place to go for information would be very convenient. Diabetes management. During the ride along, there were individuals that discussed the use of insulin and the cost. There should be more resources in the community that can help individuals get insulin at a discounted rate. Homeless shelters. The Old Northeast area lacks the use of homeless shelters. There are shelters that are close to the downtown St. Petersburg area. There were several homeless individuals outside of stores and parks. And here are our references.